One of my deepest longings really in my work with folks is that they have medical providers who really can bring their nervous systems into the room and be part of the healing process. There are so many times when I'm sitting next to someone and I am just wishing that I could have a conversation with their medical provider, because I'm seeing how that relationship in itself is causing harm to the patient because they're not feeling seen or heard. And as a consequence, they're not following through with medical treatment.
It's still early in the holiday season. Already there is no shortage of stress-provoking situations. There's a massive winter storm in the Midwest and moved into the Northeast, fouled up travel plans for Thanksgiving for, I guess, hundreds of thousands of people. Domestic international politics continue to be in turmoil. Eggs are $5 a dozen. Cucumbers are contaminated, something I'm personally offended about. Mm-hmm. And Americans of all ages, financial status, races, face the same hurdles, the same challenges of loneliness and depression that seem to exponentially increase during the holiday season. So, our guest today is Dr. Amy Balentine. She is actually, I'm going to read your bio because I'm so impressed with it. I actually made notes. So Dr. Amy Balentine is a clinical psychologist. She's the owner of the Memphis Center for Mindful Living, which I understand you operate. Does your husband work with you?
Yes, he actually helps us in a supportive role, in the IT operations role. Mm-hmm.
So we're going to talk to you about husband and wife teams working together, maybe on another episode, maybe a long episode. No stress. Yeah. You have a doctorate in clinical psychology from the University of Kentucky.
That's right.
You did additional training in UC San Diego, I understand. Mm-hmm. What'd you do there?
Well, I got my mindfulness teacher qualification in MBSR, which is mindfulness-based stress reduction. So I can teach mindfulness in addition to my work as a psychologist.
So I understand that you specialize in mindfulness and stress reduction across all ages,
That's correct.
7 years old and plus. Mm-hmm. But you also integrate a lot of, and I'm going to be very careful about this because I don't want to sound like I'm minimizing the mindfulness side of it, but evidence-based treatment protocols and treatment approaches as well.
Yes, and I would say also that the mindfulness-based interventions are evidence-based too.
Yeah, I would agree with you. Mm-hmm. I got myself into a hole there for a second. I was trying to. Thanks for digging me out of it. We're just so thrilled to have you. I think this is going to be a fascinating subject because I don't think any of us are able to get through life stress-free.
Yeah, I think it's fascinating because I would ask the initial question, and let's ask the psychologist, what is stress and what are physical manifestations of stress? And if you want to throw in, why should we care?
Well, it's interesting because a lot of times people think of stress in terms of particular stressors, and we think we know what's going to be stressful and not. But in terms of the body, stress is simply our perceived lack of resources to handle a threat. So that's why it can look like any wide-ranging event can be a stressor. So for some people, public speaking can be a stressor. For other people, it's not, because if you feel like you have the resources to handle whatever the challenge is, your body's not going to create that, stress response. So a lot of people I talk to really are very hard on themselves, judge themselves for having a stress response to something they think should not be a stressor. But there's a really important reason they're having that response, which is their body is telling them it doesn't seem like you have the resources to help you. And so I'm going to generate this stress response for you to help you meet this challenge. And so stress is such an important topic for us to talk about because our bodies are designed to help us meet the challenges of life. And so when we need that help, the body's going to respond in that way, that what we all call being stressed out. But it's really an intelligent way if we can learn to tune into the body, to listen, and to learn what we need to do to handle that challenge wisely.
When you say the body is meeting a demand. Let's
Mm-hmm.
dig in a little bit more, Lloyd. Physiologically, what happens when the body needs that extra kick?
Sure. Well, at the core of it all is the flight versus fight response,
The
right?
fight or flight. Mhm.
So biologically, we are wired that when we are faced with a threat, and again, Amy, I think that's very important because one person's threat is another person's friend, right?
Right.
And while you were talking, I couldn't help but think of my fear of heights. Most people can get on a stepladder without any problem at all. There's a reasonably good chance they're not going to fall off. I get up on step number 2 and my whole life flashes in front of me. I mean,
This is true.
Yeah,
This
thank
is
you. But it isn't so much a matter of me being endangered. It's my perceived threat and not having, as you say, the resources to deal with it. And so that combination of hormones allows our physiological response of increased heart rate, more blood to the areas that we think we're going to need, which are primarily our hands and our feet, blood shunting away from the internal organs because we really don't need those right now. We're not digesting anything. In fact, it's possible we even just got rid of some stuff just to get lighter. And when you think about that in the short term, that's a really good thing, right? We see the enemy coming over the hill, and we make one decision. That is, are we going to face that enemy, or are we going to turn around and run? Regardless of that decision, that adrenaline is going to allow us to do it. Okay. However, as Amy points out, when we're faced with a threat, a perceived threat, that flood of adrenaline and cortisol becomes problematic.
Yeah, I mean, I am curious because it's always in balance, right? We always have to have a yin to our yang. That initial stressful response of the body is needed, but what you just said was it can be harmful. So is there this magic moment where an acute stressor becomes a chronic stressor? And why is that important? Why do we need to recognize that?
Well, I can take an initial stab at that. This is what we tend to work with in psychology would be the chronic stressors. When people come in after a long period of dealing with stress because it has such an enormous impact on the body, on the mental status, just on our work, our personal relationships. I think for the most part, human bodies do not fare well. And you all can speak to the medical piece of that, but under chronic stress, it just tends to have a very deleterious effect on us. And so, once that threat, perceived threat of someone coming over the hill is gone, what we want is to come back to equilibrium in the body and in the mind, but sometimes we're not able to because sometimes in the case of trauma, it feels to us like the threat is still there. And so that threat response stays active. And so our body keeps telling us over and over that we're not safe, that there's still a threat to be managed. And so it's sort of like, just a switch getting flipped on and staying on, even after the danger may have passed. And so that's why it's problematic, because we're stuck staying and relating to ourselves and others in the world as if we're still in a space of danger, as if there's a threat that we still need to get resolved. Because, to that part of us that's still living in that trauma, that's very much the reality. And so that's where therapy and interventions come in, and we'll get to that later.
One of the models, one of the animal models for aging, there's actually 2 that are classically taught. One is the Pacific sockeye salmon. It's now pretty much all salmon. And the other one is the white-footed deer mouse. And it's pretty much all deer mice combined. But both of those are very interesting. They start their reproductive lives off as very muscular, very healthy individuals. The salmon then swims upstream to his point of origin and where he originally was hatched, the very tributary from where he was originally hatched. And that's a fascinating story in itself. And the white-footed deer mouse shops around, goes on a few dates and finds a mate, and then couples up. at the point that they actually begin the reproductive process. The white-footed deer mouse, in the case, he finds his mate and couples up and proceeds to have sex for the next 24 to 48 hours plus, whereupon he falls over dead. God love him. The sockeye salmon, as I said, swims upstream, dodges the bears, does everything he has to get back to that tributary, that one spot. He goes ahead and they spawn. It's not just a he, it's a she also. They spawn. And then they roll over and die. And there's tens of hundreds of thousands of rotting salmon, eagle and bear food. So the question is, what happened? If you go ahead and do a necropsy on these animals, if you look at them very closely and you open their hearts, Jan, you'll appreciate this from a cardiovascular standpoint, they have the worst cardiovascular disease you could possibly imagine. There's no muscle mass left. They're just floppy bags of skin and bones. But when you look at their blood vessels and their hearts and their brains, because they have blood vessels there too, they're completely clogged, and that's actually the cause of death. They die of heart attacks. And so, from an animal model of aging, it is thought that the adrenaline cortisol required to go ahead and swim upstream or to couple for 48 hours straight is enough to go ahead and create this massive rapid onset of heart disease and enough to kill you. So from a biological model, that's pretty impressive. But chronic stress, over a longer period of time, we know that it results in hormonal disruptions, right? You can have menstrual disruption and menstrual cycle disruption and infertility. It's been linked to polycystic ovarian syndrome, PCOS, right?
To early menopause.
Menopause, acne, obesity.
Sure.
Obesity and diabetes type 2.
And inflammation as well.
Inflammation in general, which is fascinating also, is because when you think about that, stress can actually mitigate. We don't know if it causes, but stress can actually go ahead and make worse arthritis. Mm. So during stressful periods of time, people who have naturally occurring arthritis, if there is such a thing, can be made much worse when exposed to stress. So all of these things, you mentioned headaches, we talk about white coat syndrome, hypertension, right? And we have fascinating conversations with people. We can actually lower their blood pressure by letting the dogs sit in there with them for a few minutes. Mm-hmm. It measurably lowers blood pressure. These immediate manifestations of stress and the longer term manifestations of chronic stress are inevitably tied to disease.
Yeah. I agree.
Yeah.
Absolutely.
Yeah, and I will just say when I have someone coming into my clinic for the first time, taking history, if they tell me that they're coming in for trauma and we're talking about all those symptoms, I'm immediately going to be very curious about their medical history. And most of the time what I find is they have more than one chronic medical disease. Yeah. And conversely, if I see someone coming in and they're talking about just pain and a lot of chronic disease, I'm always curious and I'm looking for trauma, and I almost always find it. There's just very, very high correlation.
Well, Shane, we use duloxetine? Is that the drug for chronic pain?
Yes. Right? You can use duloxetine for chronic pain. Mm-hmm.
So one of the antidepressants, right? So I mean, it's all related.
You mentioned trauma, and so I'm going to bring in a patient that we shared in common who had a traumatic event. There was an acute stressor in her young life, but then that tipped over to a chronic issue where she developed nightmares.
Night terrors. Yeah.
And we talk about this fight or flight hormone with cortisol. The typical medical institution may not chase cortisol levels unless if it is on one severe extreme or the other, hypo or very high Cushing syndrome, inappropriately high levels of cortisol. But we know that there's a bell curve, and we know that there are ranges of stress-releasing hormone in these certain illnesses. This young girl, we dug a little bit deeper. We checked stress hormones. We went looking for cortisol in her, and while her overall cortisol pattern over 24 hours was just on the high end. Her nighttime cortisol was 10 times what it should be for a normal young female her age, showing that this physical manifestation, there are labs that can show us acute and chronic stress behaviors.
But how do you deal with that, Amy? How do you deal with somebody who's had a traumatic event? And we can only presume that the physiological manifestations, so what we're able to measure, combined with her symptoms, all right, is a result of that event that occurred after the event occurred. So how do you deal with that? What do you do?
At the psychological level, in therapy, in terms of the night terrors, or just the whole picture?
The whole picture in general, because I think you can start to, sometimes we talk about, oh, you're sick. What does sick constitute? I have a sore throat. I have a fever. Well, I can give you some Tylenol for the fever, and I can give you some lozenges for the sore throat. So I think you can pick apart the individual symptoms. But overall, I agree. I'm very curious. How do you get someone to recover from that?
It's really going back to what you said at the very beginning of the podcast, where you're talking about this flight or fight response. And so what we're trying to do is bring the nervous system back to a sense of regulation, a sense of safe enough, a sense that the trauma is not occurring now. I can access a feeling of safe enough. That's what we want to do. So, it's kind of remarkable, without having to have a particular diagnosis of any kind, we can help anyone whose nervous system is not in regulation by helping it come to safety. So there's just a lot of interventions that are effective, and what they have at their root is that they are helping the person come back to a sense of safety. So there are top-down approaches, and then there's the bottom-up approaches. So top-down approaches would be, we're starting with the head, right? So we're thinking about like cognitive behavioral therapy, where we're trying to help people see things, think about things in a way that encourages a sense of safety. And so that can help some, but when we deal with the body, that's a more bottom-up approach, where we're going to the nervous system directly, and we're trying to help it come to safety. So at a very, very basic level in therapy, the therapy relationship itself is a container of safety, that hopefully this client is coming to you and is in a relationship where they feel safe, where they feel connected, they feel seen and heard, and they actually their nervous system can co-regulate with the therapist's nervous system. And so just being able to bring their stress in this space where they're feeling seen and heard and cared for and regulated can actually begin the healing itself. So that's an important message for anyone who is a healer, whether it's a medical provider or a therapist, that really seeing and being with in this caring, regulated space begins the healing process.
Yeah, that aligns very much with our philosophy at ZUP and our environment. We wanted people to have the time and the space to be heard by their provider. And that, I'm so glad to hear you say that. That very much aligns with our approach to healing as well.
Well, that's beautiful. And I'll get back to my answer to you, but I just want to asterisk this, that one of my just deepest longings really in my work with folks is that they have medical providers who really can bring their nervous systems into the room and be part of the healing process. There are so many times when I'm sitting next to someone and I am just wishing that I could have a conversation with their medical provider, because I'm seeing how that relationship in itself is causing harm to the patient, because they're not feeling seen or heard. And as a consequence, they're not following through with medical treatment. And where I'm actually having to help them do trauma work to repair that medical experience they had with that provider, where they're not feeling seen or heard, or where the medical intervention is given in a way that's actually traumatic. So I'm just going to...
Shame on us. Shame on the medical field for perpetuating that behavior. That's something that I feel very strongly that we should change.
Amy, I want to revisit something that you just said that struck a nerve, if you'll pardon the pun. And that was, you mentioned co-regulating. the nervous system, I think, between the patient and the provider. Do you think that providers who, for one reason or another, are gifted with that ability to connect to the patient can synchronize emotions and the nervous system and physically bring those patients down? And I'm going to follow that up with one additional point. And I noticed in your bio, you have a dog. Okay, so we keep a dog also, and
At the clinic.
At the clinic.
Oh,
yeah,
okay.
yeah. We're health department do not pay any attention to that. But our dog comes in with us every day. And I'm a huge believer in the connectivity between a dog looking into your eyes and you staring back at them, or vice versa. So I'm just wondering, is it possible, and I know I'm drifting, and I know you're going to tell me afterwards I need to stay on point, but is it possible that there are providers who are gifted in that communication, that very subtle subconscious communication? And is it possible that dogs share that? And are able to connect with us and bring us down, and not down in the sense of depression, but down in the sense of less anxiety.
Yes, yes. So, any animal really that, has that mammalian nervous system where we can connect and nurture each other absolutely makes a difference. And in fact, I know so many clients dealing with trauma, chronic trauma, who maybe have had a difficulty having loving, connecting relationships with humans, who have found that connection with animals, be it a dog, a horse, cat, and, also kids with, and adults too, with neurodivergence, like on the autism spectrum, where honestly, I think a lot of the challenges, nervous systems that are chronically overactivated there, and they find connection, they find regulation. And that's why, as part of our practice, we do ecotherapy, where we actually bring clients outdoors. We integrate nature in to help connect folks, because, nature, whether it's these animals or the environment around us or the humans here, this part of nature, we all regulate with each other. And I would say you don't have to have this special superhuman ability to be able to do the co-regulating. Anybody who's got a nervous system can do this. So the beautiful news is all medical providers can be trained to attune to themselves, through mindfulness, can learn co-regulation. It's not a special skill. Every parent who's ever had a kid who they picked up and rocked and soothed and comforted with their movements, with their voice, they're co-regulating, So it's an accessible skill for all of us, but we need to learn to value it and practice it. And I think medical providers, I'm just guessing, don't get a lot of this training or support in medical school on co-regulation. There's probably not a class you take.
Yeah, I think this is so interesting, because our gut as healthcare providers, sure, we can give a medicine for general anxiety disorder, but we're missing half of the opportunity to help someone through that disorder on the other side. And I love what you're saying. I think we're completely on board that we need to be integrative in our approaches, especially when there is a diagnosis involved. But we shared trauma, we shared anxiety, we said the term stress, but regardless if it's small or completely life-changing, all of this runs together. I'm curious about mindfulness specifically. Can you talk us through what that means and how a patient might benefit from, gaining some expertise in their own way?
Right. So mindfulness at its base level is just simply paying attention to the present moment. So we're all doing that, right, to varying degrees. Yeah. And the other part of that is that we're paying attention without judgment and with compassion. So that's the other secret ingredient. So it's awareness with this kind, compassionate presence, because we can pay attention with judgment, and that's not going to get us anywhere but the tense muscles you talked about, right? And our lymph nodes shutting down and all of that. So when we bring those two things together, that is a mindfulness practice. So there are formal meditation practices that we would consider mindfulness practices, but there's also just everyday mindfulness activities, which is just simply to be aware of the present moment, like doing things one at a time instead of multitasking. So whether it's something mundane like doing your dishes mindfully, or it's having a conversation with your client mindfully, those are all mindful activities. And then there's also attitudes of mindfulness. So cultivating these attitudes of curiosity and compassion, kindness. So mindfulness is really multifaceted, and I really encourage clients and do all of these. I'm encouraging the attitudes. I'm encouraging the formal practices, but also the informal ones. With the formal practices, which I think is what most people would think of when they think of mindfulness, they're thinking of breath meditation, which is wonderful because we know the breath is regulating, right, on its own.
And
we know
it's regulating the parasympathetic nervous system.
Exactly. Yeah, I was just going to say that deep breathing, right? We just activate the vagus nerve. We really activate that relaxation response. We're also cultivating a capacity to be focused and concentrate on the moment. All of us are becoming less and less capable of focus and attentiveness, right, with our society. So this is a great way to practice that. And as
do you think your marital partner should throw away her cell phone?
Just hypothetically.
I'm just asking. I off the record.
We should probably all throw away our cell phones.
Actually, a timeout, a cell phone timeout, is a really good idea, I think.
Oh, I think it's fascinating. The other part of that goes back to somebody with. We've seen an explosion of the diagnosis, attention deficit hyperactivity disorder, right, or attention deficit disorder, just an explosion of it. And I was shocked when we opened up Zup at the number of patients who would come to us who were on stimulant medications and had been on stimulant medications for 10, 15 years. Just
adults, grown adults.
Well, yes.
Even.
And so do you think we've created this within our own society rather than just that this is a recognition of a problem? I didn't phrase that very well, but what I'm getting at is that it seems to me that one of the challenges with mindfulness is that there is so much else to attract our attention. I mean, I'm having this conversation with you, and I don't know if this is a normal response. This is only me. But I can tell you exactly where the lights are placed in this room. I can tell you at what angle. I can tell you what's going on outside the window right there. I know how many cameras are happening. I know what our engineer, Scott, is doing. And that is simply because I have so much of this input coming in at me at once. So do I fall to the far right on the neurodivergence scale and I would probably benefit from some amphetamines or stimulants? Or is this a function of our society where there wasn't engineers, there weren't lights, the view outside was of forest or cattle or something. So I'm just really curious about this. I don't know if there is an answer, but we seem to have a very large number, statistically speaking, a very large number of people who are diagnosed with the inability to concentrate.
Yeah, while I don't know the answer, I do think that we have set up the ideal situation to develop inattentive people who are whose nervous systems are overactive, who have trouble settling. So I think we could probably not create a society any better for the cultivation of ADHD symptoms. I think that is true.
So we can't change society. What do we do?
Well, I don't know that I would say that. I would actually hope that we can, over time, change society. I mean, more and more, I feel like what I want to do is find ways to change society more than only focusing on taking care of folks individually, because I'm just seeing the systemic issues growing. And what I wish really more than anything else, if I could just dial down all the demands on our attention, if I could help people find more connection and community, more hopefulness, more connection to the environment, that's what I would do. And that I think it would be way more powerful than individual therapy. But we're doing what we can with what we have at the moment. And I know we can make differences to each individual person by meeting with them one-on-one. But I always try to take a both and perspective. And when I work with folks who do have ADHD, and actually, I mean, honestly, I do, my kids do, like, we have a lot of this going on in our family too. But when I'm working with folks, I am both giving them these skills and mindfulness, and I'm helping them, develop tools. And I'm also helping them see how their symptoms might correlate to the environment. And I'm helping them find ways to live in a way that's more consistent with whatever they have going on here, instead of trying to only mold or fit themselves into who they think they should be based on society standards. And I'm also trying to help them find ways to create an environment that's maybe more helpful or supportive and less just distracting, less, overstimulating for them. But the truth is, there's actually also some gifts, I think, for folks who have ADHD. There's some real... So I think the capacity to go with the flow, to be flexible, to have multiple interest. I'm kind of curious, like ER docs, for example, like how many of them have ADHD, liking that high stimulus environment, like fast pace, multitasking. I know for myself, I usually have several interests going on. It's rare for me to just only have one thing I'm doing. I love having lots of hobbies. So I think there's...
Amy, may I introduce you to my wife, Shannon?
Yeah,
Shannon, my friend
we get
Amy.
along just fine.
Sisters from a different mother. Yeah.
I love it. So there's gifts to having, if you think about it, a focused attention versus diffuse attention, there's going to be reasons to have both. And I think human beings were so adaptive that I think that's one of our reasons we're so successful as a species. We can adapt. And so if we have a society with enormous demands on our attention, we are going to develop minds that can attend to that, right?
It might be a form of resilience.
It might be a form of resilience. And if we don't like how that looks on people, that is a sign that we have a culture that is not healthy, that we are having to adapt in that way, because we have a society that is making so many demands on us.
So I feel like we're solving the world's problems
We are.
right now. I kind of want to bring it all back together again. I mean, we've talked about overall stress patterns, but we've also mentioned certain diseases that are involved in or that do require both pharmacotherapy and counseling therapy. Stress as a whole, though, as we enter in this holiday season, your tips on mindfulness, your tips on top-down and bottom-up approach can be helpful to people. If people need that medical help, we're open. We will sit. We will listen to you. You will feel heard. And we will not stop at just this is just stress. Have a nice day, because we know the physical manifestations can be detrimental to someone's health in multiple ways. Yeah. Thank you so much for being here today. I really love the ties between taking a moment and reconnecting, and how that soothes our emotional and physiologic nervous system, and how that is so important, just as medication may be important as well, but pairing the two together are certainly needed in today's society.
And Shannon will tell you that I don't do this very often, but whatever it is that we were discussing about the connectivity and the neuroregulation and I'm going to come up with a whole vocabulary for that because I really love that idea. I'm sure you are aware that you have that, you possess that. I usually walk into these things, my hands are cold and a little sweaty when we get started because I want to do a good job for my wife, and I know my life will be absolute misery if I don't. And you have a lovely ability to bring things to a level where it's calm and it's really fun. So Amy Balentine from the Memphis Center of Mindfulness, is that right?
Mindful Living?
Mindful Living. The Memphis Center for Mindful Living. It's been a pleasure having you here. We've loved talking to you and would love to have you back sometime.
Oh, I loved it too. Y'all have this gift as well.
Thank
you. I'd love to be back anytime.
Sounds great. We'll bring a dog.
Bring a dog.
Yeah,
I'll bring my dog.
bring a dog.
In the meantime, if you have stress and need help, how would someone find you?
Yes, well, we have a website, Memphis Center for Mindful Living. People can check us out there, also on Facebook and Instagram.
Okay, fantastic. And how would someone seek an appointment at ZüpMed?
Well, they probably call us directly, but don't. We're, of course, on the web at ZüpMed.com.
Or call us at
901-701-7010. I just love saying that.
Thanks, guys, for your attention.
Appreciate it. This has been just another episode of the ZüpMed podcast. We hope that you've enjoyed it. We tried to address some issues in the medical world that are interesting, fascinating, and sometimes just flat terrifying. We hope you'll join us again. And in the meantime, stay well. Thanks so much.